we are going to discuss about H3N2 virus. What is H3N2 virus? It is nothing but an influenza virus. Influenza has three types of influenza are there. Influenza type A, influenza type B and influenza type C. A is the most common and which is a respiratory virus causing illness. In A, there are many subtypes depending upon their antigenic proteins H and N. There are several proteins like H1N1, H2N2, H3NT, H5N1 and so on. There are many types of influenza A virus. H3N2 is nothing but influenza A virus. No need to worry for influenza virus. It is normal respiratory infection. Nowadays, there is a hype going on regarding in H3N2. Whether there are deaths related to H3N2, there must be hospitalization for H3N2. There are several doubts regarding H3N2. What is the mortality rate of H3N2? What is the rate of hospitalization in H3N2? So, H3N2 is a normal viral infection, same as flu. Normal flu, cold, how it is affected, same way it is affected. The only difference is in H3N2, there will be a persistent cough and certain amount of breathlessness. Many patients are asking, can it be treated at home? Yeah, you can treat your influenza, normal mild symptoms, you can treat at home. Main thing is bed rest. You should rest your body for at least for 2 to 3 days and then have plenty of oral fluids. If at all, if you have any fever, you can take paracetamol 650 or 500 mg. Apart from that, do not use any antivirals or antibiotics without any prescription. Do not use on your own. Only give a symptomatic treatment at home when there is a mild symptoms. If you have high grade fever for continuously for about 4 to 5 days and you have continuous persistent cough and when you are suffering with breathlessness, if you have severe cold and severe vomitings, diarrhea, then it is the state you should consult a doctor, nearby physician or a pulmonologist. What are the symptoms of H3N2 or any influenza viral symptoms? Usually it presents like a mild fever, cold, cough, breathlessness. If at all, if any severity of the symptoms increases, only if any other complication occurs with the influenza, then only the severity of the symptoms increases. What are the general complications of influenza? There are respiratory complications as well as extrapulmonary complications. Respiratory complications are pneumonia. Then the virus deepithelize the mucosa and enter into the alveoli. There will be infiltration in the alveoli. All the neutrophils, leukocytes will infiltrate the alveoli and there will be a presentation of pneumonia. Pneumonia is nothing but lung infection. Lung infection, it will be presented as fever, breathlessness, high grade fever with chills, breathlessness, cough and so on. And the other complication is secondary bacterial infections. When the virus invades itself and desquamatize the epithelial cell, ciliated mucous epithelium in the airways. When it gets damaged, there will be a free entry to the bacteria, so that leading to the secondary bacterial infections. So bacterial pneumonia is another complications of normal influenza. What are the extrapulmonary complications of influenza? It is a very rare but occurs more commonly with the influenza type B, myositis. It means inflammation of the muscle. There will be muscle tenderness. There will be myoglobinuria which leads to renal failure. Extrapulmonary complication is encephalitis, transmyelitis, post-infectious, post-viral encephalomyelitis will be occurring. And Guillain-Barré syndrome, this is also the very rarest complication. 1 in million will occur with the vaccination. Influenza vaccine complication is Guillain-Barré syndrome. These are all the complications of influenza. Coming to the treatment of influenza, there is a prophylaxis of influenza. Mainly prevention is better than cure. Mainly you need to prevent with the viral infection. How you have to prevent? Stop going in a crowded places, wear a mask, maintain a distance and sanitize your hands regularly. Make a distance with the infected people. Nowadays, more commonly, if one patient is getting infected, the whole family is getting infected because of the negligence. They are not maintaining a distance, they are not sanitizing their hands. and wear a mask whenever you have a respiratory symptoms like cold and cough. Other prophylactic measure is the vaccination. Vaccination is the best way to prevent the complications of influenza. There is available quadrivalent vaccine which should be taken every year from 6 months of age to elderly age group. Even pregnant women can take the influenza shot in order to prevent the complications of influenza. Coming to the treatment of the influenza, there are antiviral treatments which directly affect the influenza multiplication. These are called neuraminidase inhibitors like oseltamivir, commonly known as Fluivir. It is an oral medication, and intranasal medications are also available, as well as parenteral therapy is also available but not using in the market. We are using oral medication oseltamivir.